Well, greetings and thanks for coming. Who knows who the president was inaugurated in 1905? Anybody raise your hand, yell it out. Come on, you're all historians, right? Okay, I'll tell you. It was Teddy Roosevelt was the president in 1905, and that's when the Budge Clinic started. It's the oldest multi-specialty clinic west of the Mississippi. I had a story or two about Charlie Mayo coming out grouse hunting here, but Jana said it was an inappropriate story to tell, so I won't. I'll tell you individually, ask me later, it wasn't that bad. And of course, the founders of the Budge Clinic were directly responsible for the first hospitals built here in the Cache Valley. So obviously there's been a few changes since then. Even since I got here in 1984, where we started at the old Budge Clinic. Now, before we joined Intermountain Healthcare, there we were at the Budge Clinic, and it was great, and we were trying to grow and expand. But two things. Number one, I had to drive back and forth, so I asked somebody if they could just get a helicopter and lift the building over to this parking lot so I could, come to emergencies quicker. I would have been just happy with that. But we got a lot more than that. The best decision we made was to integrate with Intermountain Healthcare. And the reason I say that is we wanted to expand. We had a lot of motivated doctors who wanted to take good care of people. But you got to have capital to do that, and you have to have organizational help to do that. All the things that Intermountain provides for a physician to take the best possible care of somebody, we had a lot of that, but it's on a very different scale. Those of us who have come on with Intermountain have always been very grateful for the opportunities that we've had to take such good care of our patients because of that organization. Now, when we went from the old building to the quote new building, unquote, we thought, oh boy, a new building. And then we got there and about a week later we said, oh man, we were full, okay? That was our current building. So we knew there was gonna be a need for more. And at this point, with the need to hire more physicians, have more staff or more facilities to take care of people, especially in a changing climate of healthcare, this new building is going to really help significantly with that. So it's a great opportunity that we would never have had without the collaboration with Intermountain Healthcare. And it's been a symbiotic relationship that's been good for everybody. So at this point, I would like to thank all of the physicians and providers who directly take care of patients, all the support staff that do that. Without that day-to-day, patient-by-patient care, this wouldn't be, that's the essence of this. That's why we're doing all these things. In addition to that, I'd like to specifically thank Jana Huffman and her assistants, Julie Erickson and David Simmons, who have actually gotten the building of this organized. They've actually helped with the outline, worked with the physicians, worked with the architects to try to make this an effective medical facility for the 21st century. There's a lot of stuff involved with that that's really pretty interesting. We had a physician advisory group that showed up on a regular basis, and we'd say, okay, what do you think of this, this? We tried to do it from the ground up, and the organization has been absolutely fantastic. At any rate, I'd like to thank all of those physicians as well, and all of you for coming today. So, thank you.